Hi, I'm Dr. Lee. So why the interest in oxygen? I think we all know how critical oxygen is to healing. But oxygen is unique in that it plays a significant role during every phase of that process. Patients, such as those with diabetes who suffer from persistent poor perfusion, can truly benefit from ongoing supplemental oxygen. However, it does need to be manageable in the home care setting, as this is where our patients reside. Every product promises to improve clinical outcomes. And as a clinician, I need to assess whether these products truly do help my patients. So I identified 5 patients that had failed to respond to standard of care. I did debridement, offloading, managed the bacteria loads, and moisture management. These patients all had TCPO2 levels that were below the threshold for healing. Started them on Natrox oxygen wound therapy. These patients with non-healing ulcers weren't without challenges. As you can see in the photos here, 2 patients had previous amputations. Even the patient who hadn't endured an amputation had a wound for 10 months. The first 2 patients showed significant wound reduction, and both went on to heal shortly after the 12-week study period. The third patient, who healed in just 10 weeks under the normal 12 weeks, had a really deep wound, so topical oxygen therapy isn't just for superficial ulcers. The complex wounds were even more challenging. Not only did they both have low TCPO2 levels, but they were older with multiple comorbidities and had previously undergone amputation and reperfusion procedures. Patient number 4 was managed with continuous topical oxygen therapy and an amniotic product, and then he was able to start to heal rather quickly. Patient number 5, as you can see in the photo, considering his starting point and the rapid deterioration prior to initiation of the continuous topical oxygen therapy, after only 4 weeks had demonstrated granulation tissue. I mean, it's pretty amazing. Sadly, though, this patient died during the study due to unrelated issues, so I don't have further photos to show you. So in conclusion, managing diabetic foot patients is always challenging. Having therapies that make a difference are very important. Continuous topical oxygen therapy demonstrates great efficiency in this patient group. Not only did it stimulate wound healing in all of them, but it was simple and easy for them to manage and allowed them to go on with their daily living activities while healing. The added benefit for me is the flexibility. I can use it with any standard dressing and in conjunction with my other advanced treatment modalities. This gives me complete freedom to tailor my treatment regimen to my individual patient's needs. Thanks for stopping by.